What if a habit you have followed for decades is no longer working with your body, but quietly working against it? For many older men, this change happens so gradually that they never realize what is going on. They continue using the same routine, the same pressure, the same speed, and the same expectations they had when they were younger. But after 60, your body is not the same body it was at 30 or 40. Your circulation changes, your nerves respond differently, your skin becomes more delicate, and your recovery may take longer. And when your habits stay exactly the same, while your body continues to change, something that once felt completely normal can eventually lead to irritation, reduced sensitivity, frustration, or discomfort. The good news is that this does not mean something is wrong with you. It means your approach may simply need to change. Before we go further, if protecting your health, confidence, and vitality as you age matters to you, take a moment to subscribe to the channel and like this video. That small action helps this information reach more men who may be experiencing the same changes but feel uncomfortable talking about them. And tell me in the comments where you're watching from. I always enjoy seeing men from different countries and communities coming together to learn about their health. I'm Dr. Rose, a board-certified urologist, and for years I've helped men understand the changes that can happen as they get older. Today, I'm going to walk you through how to make your self-care routine gentler, safer, and more responsive to the body you have today, rather than the body you had decades ago. And I want to begin with one message that I believe every man over 60 needs to hear. You are not broken. Many men become worried, confused, or even embarrassed when their body no longer reacts exactly as it once did. But this isn't a personal failure. It's biology. As men age, testosterone gradually declines. That does not automatically eliminate sexual interest, but desire may become less spontaneous and may require more time and stimulation. Blood flow can also change as the small vessels supplying the pelvic region become less flexible. As a result, arousal may take longer, and maintaining a firm response may become more difficult than it was when you were younger. Your nervous system can change as well. Sensations may feel less intense, and your brain may need more time to recognize and respond to physical signals. So the important point is this: the techniques and habits that worked for you in your 20s, 30s, 40s, or even 50s may not necessarily be the best approach now. That isn't your fault. Your body has simply entered a different stage of life, and your habits need to adapt with it. Unfortunately, many men respond to these changes by doing exactly the opposite of what their body needs. They use more pressure, move faster, become more focused on reaching the end result, and assume that increasing intensity will solve the problem. In reality, that approach can sometimes make sensitivity and comfort worse. So let's begin with the first mistake I commonly see, and more importantly, what you can do differently. The first mistake is using the same level of pressure you have relied on for years. After 60, the skin and tissues in the genital area can become more delicate, and repeated friction or excessive pressure may lead to irritation and discomfort. A technique that your body tolerated easily when you were younger may feel very different now. Strong pressure can also reduce your awareness of subtle sensations, making it harder to recognize what your body is actually responding to. The solution is surprisingly simple. Reduce the pressure and approach the experience with a gentler mindset. Think of it as exploration rather than force. Your goal should not be to create the strongest possible physical sensation. Instead, focus on comfort, awareness, and allowing your nervous system enough time to respond naturally. Sometimes, less pressure provides more useful information about what your body currently needs. The second mistake is moving too quickly, especially at the beginning. When your nervous system becomes less responsive with age, rushing the process can actually make sensations feel less noticeable. Your brain needs time to receive, interpret, and respond to physical signals. If everything happens too quickly, you may find yourself concentrating more on trying to reach a certain result than actually noticing what you feel. A better approach is to slow things down. Use steady, comfortable movements and give your body time to adjust. Think about rhythm rather than speed. This allows your mind and nervous system to stay connected instead of turning the experience into something mechanical. Remember, there is no prize for finishing quickly. After 60, patience can become one of the most valuable parts of maintaining comfort and sensitivity. The third mistake is overlooking lubrication. As men age, hormonal changes can affect the body's natural moisture, and the skin may become more vulnerable to dryness and friction. When dry skin is repeatedly exposed to rubbing, even a routine that once seemed harmless can produce irritation, soreness, or tiny areas of skin damage. That's why lubrication should not be treated as something you remember only after discomfort begins. If you need it, use a gentle, unscented, water-based lubricant from the beginning. The purpose is not simply to make the experience more comfortable. It also helps reduce unnecessary friction and allows the skin to move more smoothly. If you notice persistent irritation despite making these changes, that's a reason to stop and speak with a healthcare professional rather than simply adding more pressure or continuing through discomfort. The fourth mistake is putting too much pressure on yourself to reach a particular outcome. This is one of the most overlooked issues because many men have spent decades believing that sexual satisfaction must end in one specific way. But aging doesn't always follow that pattern. Arousal can come in waves. Some days your response may be stronger, while on other days it may be slower or less predictable. That's normal. The more you tell yourself that you have to reach a certain result, the more likely stress and performance anxiety are to interfere with relaxation and enjoyment. Instead, remove the stopwatch from the equation. Give yourself permission to experience the process without turning it into a test. Satisfaction does not have to look exactly the same every time, and reaching a climax is not the only measure of whether your body responded successfully. The fifth mistake is ignoring the signals your body is giving you. After decades of following the same routine, it is easy to operate on autopilot. You may automatically repeat the same movements, the same pressure, and the same timing without asking whether your body still responds well to them. But after 60, awareness becomes much more important than repetition. If something feels dull, change your approach. If something feels uncomfortable, stop rather than trying to push through it. If a particular gentle approach feels better, give your body time to respond to it. Your body is giving you information all the time, and learning to listen to those signals can help you adapt much more effectively than simply repeating an old habit. So what does a healthier approach actually look like? Let's walk through it step by step. First, choose a time when you won't feel rushed. Give yourself perhaps 15 to 20 minutes of privacy rather than trying to fit everything into a few hurried moments. Your nervous system responds better when you feel comfortable and unpressured. The environment matters too. A quiet, warm room, comfortable clothing, soft lighting, or even calming background music can help you relax. This isn't about creating some elaborate ritual. It's simply about removing unnecessary tension from the situation. Then start with your breathing. Before beginning any physical stimulation, take several slow breaths. Breathe in gently through your nose and slowly exhale through your mouth. This can help you shift your attention away from pressure and toward the present moment. When you're relaxed, you're more likely to notice subtle changes in sensation and recognize what feels comfortable. Next, if lubrication is needed, apply it early rather than waiting until friction becomes noticeable. Give your skin the benefit of reduced friction from the beginning, then take your time. Think less about completing a task and more about understanding how your body responds today. You can vary pressure and rhythm within what feels comfortable, but there should never be a need to force a sensation. And if your level of arousal changes or temporarily decreases, don't immediately assume something is wrong. Bodies are not machines. Responses naturally rise and fall, particularly as we get older. Breathing also matters throughout the process. Holding your breath or becoming tense can make it harder to remain relaxed, while slow breathing encourages you to stay present. Another factor many men overlook is body position. If you're sitting in an uncomfortable position for an extended period, especially on a hard surface, you may place unnecessary pressure on the pelvic region. Instead, choose a position that provides adequate support and allows you to remain relaxed. Reclining with support behind your back, lying comfortably on your side, or slightly elevating your legs may be more comfortable for some men. The principle is simple. Don't allow your position to create unnecessary pressure, numbness, or discomfort. If you notice unusual sensations or persistent numbness, stop and give your body time to recover rather than continuing through it. Some men also find that specially designed personal care aids can make physical stimulation more comfortable because they can reduce the need for excessive pressure. If you ever consider using one, the same principle applies. Choose something designed with comfort and safety in mind. Follow the manufacturer's instructions, and never use anything that causes pain, numbness, skin irritation, or unusual discomfort. These kinds of tools should never be viewed as a requirement. They are simply optional aids that may help some men adapt to physical changes, much like glasses can support changing vision or hearing devices can assist when hearing becomes more difficult. The important thing is not the tool itself. It's whether the approach helps you stay comfortable and listen to your body's signals. Now let's talk about something that is just as important as technique, and that's your mindset. After 60, self-touch is not only a physical experience, it can also be connected to emotions, confidence, identity, and the way you view your aging body. Many men carry expectations that everything should happen exactly as it did when they were younger. They may believe that they should become aroused at the same speed, experience the same intensity, and reach the same result every time. And when that doesn't happen, they immediately think something is wrong. But that's the wrong conclusion. Your body is changing, and changing does not mean failing. Your response may become slower. Sensations may feel different. You may need more time to become fully comfortable. Your level of interest may also vary from one day to another. None of these changes automatically mean that you have lost your vitality. They simply mean that your body is communicating with you differently. This is why I encourage men to replace performance with awareness. Don't treat the experience like a test that you have to pass. Don't compare every response with what happened 20 or 30 years ago. And don't measure your health by whether your body behaves exactly as it once did. Instead, focus on comfort, connection, and understanding. Think of this stage of life as an opportunity to become more familiar with your body rather than less. When you're younger, many physical responses happen quickly and automatically, so you may never have had a reason to pay close attention. But with age, you may discover that slowing down actually gives you a better understanding of what works for you now. You can become more aware of tension, comfort, sensation, breathing, and emotional state. That awareness can be valuable far beyond this one area of health because it teaches you to notice changes instead of ignoring them. And there is another important point I want every man listening to understand. Not every change should simply be blamed on aging. Some changes are completely normal, but certain symptoms deserve medical attention. If you experience persistent pain or discomfort during or after self-touch, particularly when it continues despite using adequate lubrication and reducing friction, don't simply accept it as something you have to live with. Ongoing pain deserves an explanation. Your body shouldn't repeatedly hurt during a normal activity without you understanding why. The same applies to sudden or persistent numbness. A gradual change in sensitivity can occur with age, but a noticeable or sudden reduction in sensation should not be ignored, especially if it continues or is accompanied by other symptoms. Your nerves and circulation are important parts of sexual and pelvic health, and unusual changes can sometimes provide useful clues about an underlying issue. You don't need to panic, but you should pay attention. Another sign worth discussing with your doctor is a persistent inability to achieve or maintain an erection, even when you're relaxed, comfortable, and in a private setting. Occasional difficulty is common and can happen because of stress, tiredness, medication, alcohol, relationship concerns, or many other temporary factors. But when the problem becomes consistent, it's worth investigating. Erectile changes can sometimes be connected to blood vessel health, diabetes, medication effects, hormonal changes, or other medical conditions. In some cases, sexual changes can even appear before a man notices other symptoms of cardiovascular or metabolic problems. That's one reason I don't recommend simply accepting persistent changes as an unavoidable part of getting older. And finally, don't overlook the emotional side of the issue. If self-care is consistently associated with anxiety, frustration, shame, guilt, or distress, that matters too. Your sexual health is connected to your overall well-being. You don't have to feel embarrassed about discussing these concerns with a qualified healthcare professional. Urologists hear these questions every day, and there is no need to feel ashamed for asking them. In fact, bringing up an uncomfortable subject can sometimes be one of the most useful steps you take for your health. Talking with a urologist isn't a sign of weakness. It's a practical decision, a conversation, and, when appropriate, a simple evaluation may provide reassurance, identify a treatable problem, or give you a clearer understanding of what is happening inside your body. You don't have to wait until a problem becomes severe before mentioning it. If something has changed and you're concerned, that's already a valid reason to ask questions. So let's step back and bring everything together. The goal after 60 isn't to force your body to behave like it did decades ago. The goal is to understand the body you have today and adapt your habits accordingly. That means reducing unnecessary pressure, slowing down, using lubrication when appropriate, paying attention to comfort, and letting go of outdated expectations about what a successful experience is supposed to look like. The more you listen to your body, the easier it becomes to recognize the difference between a normal change and a warning sign that deserves attention. And perhaps the most important lesson is that aging doesn't mean you have to give up pleasure, intimacy, or confidence. It simply means you may need a different approach. Your body is not broken because it responds more slowly. It is not failing because sensations have changed. It is adapting to a new stage of life, and your habits should adapt with it. When you stop fighting those changes and start working with them, you can develop a healthier relationship with your body and a much more realistic understanding of what sexual wellness can look like after 60. There is something deeply important about accepting these changes rather than constantly trying to recreate the past. When you stop comparing today's body with the body you had decades ago, you can begin to focus on what your body is actually telling you right now. That shift in perspective can make a significant difference. Instead of thinking, "Why can't I respond the way I used to?" ask yourself, "What does my body need today?" That is a much healthier question. It moves you away from frustration and toward awareness. And for many older men, that awareness is exactly what has been missing. Remember, this isn't a race. It isn't a performance test, and it certainly isn't a measurement of your masculinity or your worth. Your body doesn't have to prove anything to you. There may be days when your response is stronger, and days when it is quieter. There may be times when you feel interested, and other times when you don't. Stress, sleep, medications, exercise, mood, relationships, and general health can all influence sexual response. Instead of judging yourself for these variations, recognize them as information. Your body is constantly responding to the conditions around it, and learning to notice those patterns can help you make better decisions about your health. One of the biggest mistakes older men can make is assuming that every sexual change is simply the price of getting older. Age does bring changes, but persistent or significant problems deserve attention. If your sensitivity suddenly changes, if discomfort continues, or if your erectile response consistently becomes weaker, don't automatically dismiss it. These symptoms can sometimes be related to circulation, nerve function, hormones, medications, diabetes, cardiovascular health, or other conditions that may be manageable with proper care. You don't need to assume the worst, but you also don't need to ignore something simply because you're over 60. This is especially important when it comes to circulation. The blood vessels involved in erectile function are small and sensitive to changes in overall vascular health. Conditions that affect circulation elsewhere in the body can also influence sexual function. That's why maintaining a healthy weight, staying physically active, managing blood pressure, controlling blood sugar, avoiding tobacco, getting adequate sleep, and following a balanced diet can all contribute to better overall sexual health. A healthy sexual response doesn't come from one technique alone. It is influenced by the condition of your entire body. The same principle applies to your nervous system. Sensation depends on healthy communication between your skin, nerves, spinal pathways, and brain. If you experience ongoing numbness, tingling, burning, or a significant change in sensation, it is worth discussing with your doctor. Certain medications, nerve conditions, metabolic problems, and other health issues can affect sensation. Again, the point isn't to create fear, it's to encourage awareness. The earlier you identify a meaningful change, the more options you may have for addressing it. And let's not forget the role of medications. Many men over 60 take prescription medicines for blood pressure, cholesterol, diabetes, depression, urinary symptoms, or other chronic conditions. Some medications can influence libido, erection quality, or sensation. That doesn't mean you should stop taking anything on your own. Never discontinue a prescribed medication without speaking with the clinician who manages it. Instead, if you notice a change after starting or adjusting a medication, mention it. Your doctor may be able to identify another explanation or consider whether an alternative treatment is appropriate. Your emotional health deserves the same level of attention. Anxiety can affect sexual response even when the body itself is physically healthy. If you're constantly monitoring whether your body will respond, worrying about how long it will take, or comparing every experience with your younger years, that mental pressure can become part of the problem. The more you demand a particular response, the harder it can become to relax. This is why I encourage men to remove unnecessary expectations. Give yourself permission to slow down, to pause, and to accept that every experience does not need to produce exactly the same result. There is also something freeing about understanding that satisfaction can exist without a perfect physical response. Many men have been taught, directly or indirectly, that sexual health is defined by performance. But health is much broader than that. Comfort matters, emotional well-being matters, confidence matters, feeling connected to your body matters, being able to communicate openly with your partner and your healthcare provider matters. When you define sexual wellness more broadly, normal variations become much easier to accept. So if you've noticed that your old routine no longer feels the same, don't immediately assume you've lost something permanently. First, slow down and pay attention. Consider whether you're using unnecessary pressure. Consider whether dryness or friction is contributing to discomfort. Consider whether you're rushing because you feel you need to reach a particular result. And consider whether stress, poor sleep, medications, alcohol, or another health issue could be affecting your response. Sometimes a few thoughtful changes can make a meaningful difference. At the same time, don't try to solve every problem yourself. If discomfort persists, if sensation changes significantly, or if erectile difficulties become consistent, speak with a qualified healthcare professional. A urologist can help determine whether the change is primarily related to normal aging, medication, circulation, hormones, nerves, or another factor. The purpose of an evaluation isn't to judge you, it's to give you information. And this is where the idea of adapting becomes so important. Adaptation doesn't mean giving up. It means becoming smarter about how you care for yourself. The habits that served you when you were younger may have been perfectly reasonable for that stage of life, but your body has different needs now. You don't have to fight those changes. You can respond to them with patience, flexibility, and better awareness. When you approach self-care this way, the goal changes completely. You're no longer trying to recreate an experience from 20 years ago. You're learning how your body works today. You're paying attention to comfort rather than force. You're allowing your nervous system time to respond rather than demanding immediate results. You're treating changes in sensation as information rather than as evidence that something is wrong with you. That is the mindset I want you to take away from this video. Your body is not your enemy. It is communicating with you. Sometimes the message is simply that you need to slow down. Sometimes it is telling you that a particular habit needs to change. And sometimes it may be telling you that it's time to speak with a doctor. The key is learning to recognize the difference. After 60, sexual wellness can still be a healthy and meaningful part of life. It may look different than it did when you were younger, but different does not automatically mean worse. In many cases, becoming more patient and aware can actually help you develop a deeper understanding of your body. You may discover that comfort, relaxation, and connection are more valuable than intensity or speed. And that is not a loss. It is simply a different stage of life with different priorities. So, let's bring everything together one final time. After 60, the goal is not to force your body back into the patterns that worked when you were younger. The goal is to move forward with greater awareness and respect for the changes your body is going through. That means reducing unnecessary pressure, slowing your pace, using appropriate lubrication when needed, paying attention to your body's signals, and letting go of the idea that every experience has to end in exactly the same way. Your body does not need to perform on command for you to be healthy. It needs to be listened to, cared for, and given enough time to respond. If you remember only a few things from this video, remember these. Be gentle with yourself. Don't assume that more pressure will produce a better response. Don't rush simply because that's what you've always done. Don't ignore discomfort, numbness, or significant changes in sensation. And don't turn sexual wellness into a test of your age, masculinity, or physical ability. Your body is allowed to change. What matters is how you respond to those changes. There is also no reason to feel ashamed about discussing these subjects. Sexual health is part of overall health, and questions about changes in sensitivity, erections, desire, comfort, or confidence are extremely common. If something concerns you, speaking with a urologist can provide answers that internet searches and assumptions simply cannot. A professional can look at your symptoms in context, review your medications and health history, and determine whether further evaluation is necessary. Sometimes, the answer is reassurance. Sometimes it's a simple adjustment, and sometimes an underlying condition needs treatment. Either way, knowing what is happening is better than worrying about it in silence. And please remember that healthy aging is not about trying to stop time. It's about learning how to live well as your body changes. The same principle applies to your heart, your muscles, your sleep, your digestion, your prostate health, and your sexual well-being. You don't have to remain exactly the same to remain healthy. You simply need to understand what your body requires at each stage of life and make thoughtful adjustments. Your sexual health can remain an important part of your quality of life well beyond 60. It may become slower. It may require more patience. Your responses may be less predictable than they once were. But those changes do not automatically mean that pleasure, confidence, or intimacy have disappeared. In fact, when you stop chasing the past and start paying attention to the present, you may find a different kind of satisfaction, one that is calmer, more comfortable, and more connected to your overall well-being. So if you've been wondering why your old routine doesn't seem to work the same way anymore, don't immediately blame yourself. Don't assume you've failed, and don't automatically believe that nothing can be done. Start by listening, slow down, reduce unnecessary friction and pressure. Give your body time to respond. Pay attention to what feels comfortable and what doesn't. And if something seems unusual or persistent, get it checked. Most importantly, remember this: your body is not broken. It is evolving. Aging changes the way your circulation, hormones, nerves, skin, muscles, and brain respond, and those changes are part of being human. The healthiest approach is not to fight your body or demand that it behave exactly as it did decades ago. It is to work with your body, understand its signals, and give it the care it deserves. If this video helped you understand your body a little better, please like the video, share it with someone who may benefit from this information, and subscribe to the channel. There are many men who experience these changes, but never ask about them because they feel embarrassed or believe they are simply supposed to accept them. Sometimes, one honest conversation or one educational video can encourage someone to finally seek the help they need. And before you leave, there's another important question worth discussing. There are certain everyday habits that may influence prostate and urinary health, and some men may unknowingly repeat them for years without realizing the connection. If you want to learn more about how your routine can affect your prostate health and what signs you should never ignore, watch the next video. It could give you a completely different perspective on the way you approach your health after 60. I'm Dr. Rose, and remember, taking care of yourself isn't about proving that you're still the man you were decades ago. It's about respecting the man you are today. Stay informed, listen to your body, and never be afraid to ask for professional guidance when something changes. I'll see you in the next video.